Welcome back to Sleep Medicine and Physical Therapy, Part 3, Physiotherapeutic Management of Sleep Disturbances. Today's topic is excessive daytime sleepiness, physiotherapeutic approach. This is Chris, physiotherapy student, and let's get things started. Introduction. Excessive daytime sleepiness, EDS, as seen in the previous chapter, is a symptom of many diseases and can be a debilitating and an overwhelming condition. Excessive daytime sleepiness may indicate an undiagnosed sleep disorder or other condition, and it can also impair development and daily function. Moreover, EDS makes it difficult for patients to adjust to school and work, and can concentrate on their abilities. The disease diagnosis needs to be done by a physician and will help to direct and focus the physiotherapeutic treatment. For that, physical therapy might help in the management of the symptom and in the treatment of the disease itself, identifying the modifiable risk factors which could alleviate or prevent EDS, such as sedentary behavior. Consequently, the general and main aim of physiotherapy treating EDS is to maintain vigilance. Exercise and physical activity. For EDS, exercise might help directly and indirectly. There is no consensus until now on exercise improving EDS, neither in an acute or chronic manner. Indirectly, exercise can improve obesity, muscular performance, inflammation, diabetes, metabolic syndrome, and sleep apnea, which impact EDS having it as a symptom. From observational studies, we know that lack of exercise is associated with increased EDS in children, adults, and older adults. Lack of exercise has also been known as an independent predictor of EDS in men with sleep apnea, being independent of the degree of apnea. Also, strength, 55 minutes, 3 times a day for 12 weeks, 3 sets of 10 to 12 repetitions with a 10-minute rest interval between sets, reduced EDS in adolescents. In addition, evidence on weekly engagement in leisure time moderate physical activity, for example walking, was significantly associated with a 30% lower chance of reporting EDS, indicating that a non-sedentary way of life is a choice to prevent many diseases and EDS. The significance of moderate intensity physical activity cannot be neglected, as moderate intensity physical activity is associated with numerous health benefits compared with high intensity physical activity. Nevertheless, for those already engaged in moderate intensity physical activity, supplementary health benefits may perhaps be achieved with high intensity and or duration. One investigation on low to moderate intensity physical activity, for example Tai Chi program, performed for 6 months including older adults complaining of sleep, demonstrated that Tai Chi participants reported reduced EDS compared with controls. With a broad range of age, between 18 and 85 years, another investigation showed that the relative risk of often versus never having EDS decreased by a factor of 0.65 for those meeting physical activity guidelines, compared with their counterparts not meeting the guidelines. Taken together, evidence points out that meeting physical activity guidelines, including exercise, is of importance for all and also for sleep and EDS. The mechanism through which exercise specifically improves excessive daytime sleepiness is not clear and depends on the disease or condition investigated. Regular exercise has anti-inflammatory effects, altering cytokine responses such as the C-reactive protein, tumor necrosis factor alpha, and interleukin 6, and in this manner may prevent EDS. Another possibility is that exercise improves sleepiness by influencing mood. Furthermore, exercise improves metabolic factors such as visceral fat and insulin resistance that have been shown to be independently associated with EDS. Final words. From a clinical standpoint, we suggest that physical activity, including exercise, should be part of the comprehensive clinical assessment of patients with excessive daytime sleepiness. Regular exercise should be recommended to those patients that are sedentary or have sedentary behavior. This is Chris, physiotherapy student. Hope you've learned something from today's topic of excessive daytime sleepiness physiotherapeutic approach.